Hello, it's Marta from Panacea Digital. I'm a UX design consultant specialized in digital health, and in this video, I'll be breaking down the user experience design of an application called KmAsthma. So, this is an app for tracking asthma symptoms, and let's just start by having a brief look at the App Store page, because this is where most of the users will come to have a look before they download the app. So let's see what they're saying in the description. Put asthma in its place. KmAsthma was named and co-designed by young people with asthma to meet their needs. KmAsthma gives you a quick access to emergency help, your action plan, medication reminders, tips and strategies, and more. So from this brief look, we can see it's a kind of typical health and wellness tracking application where you can track your symptoms. You're gonna get some recommendations. It will remind you to take your medication. And you probably have some educational resources as well. So let's have a quick look at the screenshots. So the first one is just showing me the homepage. So I can see the emergency support, log my symptoms, so I know there's going to be some tracking, profile history, that's kind of alluding just going to be some graphs, goals, reminders, connect, so probably some community area where I can connect with maybe other patients, and about asthma, so that's probably the educational, informative area. And I can see a daily tip, so maybe they'll be giving me like a small tips every day. So the second screenshot, I can see this is a logbook and I can see a date. So that's where I'm going to be tracking my symptoms. That's quite self-explanatory. Then the next screenshot, we have a monster assistant assigned. Cutie Pie has been assigned to this goal. Cutie Pie will check in with you each week, track your progress, and provide moral support. Okay, so that's, we've read here that it's been named and co-designed by young people with asthma to meet their needs, so we can understand this is, this specific application is targeted at kids and young people. So probably we can assume that they'll be using this kind of monster characters to make it more engaging, and make it more entertaining for kids to use this application. And then the last screenshot, you can see history, track your asthma over time, and a calendar view. So yeah, that's probably where I can see maybe a monthly summary of what the severity of my symptoms were. Okay, so that's giving us some idea of what to expect from this application. So let's get to the actual review and breakdown of this application. So what I've done is that I took screenshots of all the key user flows, so we can see step by step how the user is moving from one screen to another, and I'll just go through them one by one, discussing what they're currently doing well and calling out some recommended changes where I feel like the experience could be improved. So let's start with the onboarding flow. So the first screen that I see as soon as I downloaded and opened the application is actually a notification prompt. So it says allow notifications so your monsters can communicate with you and so you can add reminders. So the first thing they're asking me to do is actually opt in to the notifications. So if I click OK, I will just see the kind of generic iOS push notification prompt, so I can allow or not allow. From there, I'm really just ready to get started, to be honest. So congratulations, you're now part of the community. Get started. So if I click get started, I'll get directly to the home page of the application. So on the homepage, they're really kind of just calling out the main areas of the application. So on the top, emergency support, goals in progress, and monster on duty. I can see that 0. I don't have any goals in progress yet. I've not started any goals yet. And this monster on duty, I can see there will be 1 here. It's not really telling me how to start this. How do I get a monster to appear there? But I can also see that I can log my symptoms. So that's the option that they kind of promoting and calling out here. And then some of the other areas: profile, history, goals, reminders, connect. So that's probably some community area, and about asthma. And I can see a daily tip. So yeah, so this is kind of the same screen we've seen on the App Store. Okay, so that's quite a simple experience here. So let's have a think about the things that they're doing well to start with. So the flow is very short, so that's good. They're actually not asking me to create the account, so I can just use the application as a guest in a way without creating an account. And they're not asking me for any personal information as part of this onboarding flow, like a lot of the apps are doing. So the simplicity and the fact that it's very short is actually good, because at the point of downloading the app, people typically just want to get into the application and see how it works. So at the point of download, they're not really decided that they want to use it yet, because they've not tried it, they've not seen it yet. They don't actually know how it works. So the less roadblocks we're putting in front of users, the better. The less work we're actually asking them to do in the onboarding flow, the better, because at that point they don't really have a lot of trust and a lot of confidence in this application. They just kind of want to get in and see how it works. So any kind of additional work and additional things that we're asking them to do as part of onboarding flow could be a potential friction point that can actually get people to drop off. And also another thing to remember is that most often than not, people are going to download 3 or 4 similar applications, try them all, and then decide based on that one-off interaction, they're going to decide which one they want to use. So also it's important to remember that your product is probably not the only one that they're trying. So again, the less roadblocks and the less friction points you put on their journey, especially in that initial onboarding flow, that first time interaction, the highest the chances that they're actually going to choose your app over the other 2 or 3 that they tried. So in terms of some changes that I feel like would improve the experience, so in relation to the point about people just trying the app first, when they download the app, they're not they haven't decided yet that they actually want to use it. They just want to see if it's going to help them solve the problem or achieve the goals that they're looking for from the interaction with this app. So again, in this first interaction, it's very important that you actually give the user a sense of how this product will help. And I feel like it's good that this flow is very short, but it's almost too short, because as it is right now, it's not really giving me that sense of, okay, I can see how this app works and I can see how it's actually gonna help me. So there's a few things that could be changed to kind of get that sense of how this app is actually going to help me. So one thing is that they could incorporate some goal setting in this flow. So we'll see further in this video. They actually do have goals. I mean, we can already see it here from the first interaction. There is some goals in progress. So I can already assume it's kind of alluding, even though I haven't set any goals up, I haven't set any up yet. I can see that there are some goals I can track in this application. So they could bring that goal setting upfront into this first time experience. So the reason why that could be a good idea is because if the user sets some goals up, they've already committed to some healthy actions for themselves. They've committed to taking some steps to help them manage their asthma. In this first interaction, this very first use of this app, they could already get a sense of, okay, so this is how it works. These are my goals now. I can see how this app will help me. So bringing that goal setting experience into the forefront of the onboarding flow could really help the user understand, okay, this is how it works. This is how it's going to help me. The second thing they could do is they could actually prompt people to take some small action in this application. So a lot of the apps, health apps, do heavily rely on tracking and logging the symptoms. So this is part of just prompting the user to build more of awareness of themselves and how they're experiencing the symptoms, maybe what's triggering the symptoms. But very often this is quite a big part of health applications. So they could actually straight away just prompt me to do my first entry. And again, once I went through this entry, I could get a better sense for how this application is working. And I could have a feel that I've already, in this first interaction, I've already took some steps that will help me manage my asthma and manage my symptoms. And then if the user gets that sense of satisfaction from the first interaction with the app, then that increases the chances that they will decide to stick with this app because they've already seen a little bit, they've already experienced a little bit, and they can see how the application can help them. And then the last thing I would say is simplifying the homepage and focusing the homepage on the main things that you'd want the user to do in the app every day. So usually I recommend that the homepage is really focused around that core interaction. So if you ask yourself, if the user comes to this app every day and they only take one action, what is that one most important action that you want them to take? So, and then simplifying the homepage is really about the fact that we have limited attention spans and we can only pay attention to so many things at the same time. So the more things on the screen, the less likely it is that I will actually take action or pay attention to any individual piece of information. So right now we have, let's say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 different pieces of information on the screen. Now, if we think about what are the main things that the user should probably do in this app every time they open it, I would say the first one is something related to my goals. So if I'm using this application to track my goals and see my progress, that's probably one of the first things I want to see when I come to this app. And then the second one is probably tracking and logging my symptoms. So again, for this kind of tracking, for this to be useful, it has to be done on a frequent basis. So I can build up enough data to actually see some progress and see some patterns. So then the second thing that they'd probably want the user to do either every time or relatively frequently is to log their symptoms. And then I would say this emergency support, because that's probably, if you're in an emergency situation, you want to access that functionality straight away. So actually, out of those 11 things, I would say that those 3 things are actually the most important. So the other things they're kind of directing me to other areas of the app, which in a way they're doing the same thing as the navigation here. So it's almost duplicating the same functionality, but without bringing any added benefit or even hindering the experience, because the more things I have on the screen competing for my attention, the lower is the probability that I will actually action any of them. So simplifying this page to focus on those 3 most important things would really prompt the user to take action on one of them. So if I land on the screen and I can see straight away, these are the 3 things I should be paying attention, then that can really help me understand, okay, what's the most important thing I should be doing in this app? And again, it's giving me more understanding of what's the value of this application and how it can actually help me. So next, have a look at the tracking options in this application. So to track my symptoms, I can go from the home page through this log symptoms button, or I can go directly in the navigation bar through this calendar icon. So if I go from here, the app will just bring up the tracking screen. So the first thing I can track is obviously the symptoms. So which symptoms did you have today? Wheeze, cough, mucus, chest tightness, and so on, so on. The next thing I can track is the overall severity of my symptoms today. So from no bother to extremely bothersome. I can track mood as well, how I was feeling today. Then I can add asthma attacks. So if I want to log an attack, it will take me to this kind of screen where I have to specify when the attack happened today, the duration of attack, trigger, and then through this drop down, I can actually select the severity of it. So, for example, I said I could only say a few words, so it's this kind of descriptive way of indicating the severity of the attack. So if I save the attack, I can see on my tracking screen here, it's recorded my attack, and then I can add some additional notes if I want to, and then I can save my tracking entry for today. Once I saved the entry, it's just going to take me to a read-only view of my entry for today, where I can just see the summary of the things that I've entered, and I can edit if I want to. So that's how the tracking works in this application. A few things that are working pretty well. So the app does give the user a lot of useful default tracking categories. So all of those things, symptoms, severity, asthma attacks, obviously all of those things are things that an asthma patient might want to track. And they also given the user the possibility to add notes, so for some additional context. So that's very important, to give user the possibility to add that additional bit of context and record any custom things that are not covered by those default tracking categories. And that's because health is a very personal topic, so people might experience it differently from patient to patient, even when we're talking about the same condition, different people will have different reflections, different experiences, even about the same condition. So it's always very important to give people the ability to record that additional context and the kind of custom information that they might want to track. Then another thing that's working quite well, it's a simple thing, but the fact that there is a explicit visible save button is actually good. So one thing that I've observed in some user testing sessions that I did in the past with different applications was that quite a few apps actually they don't have the save button at the bottom, because what's happening is that the app is just auto-saving everything as the user is going through the tracking screen and selecting their options. So the user doesn't have to explicitly save everything, and that might sound like a good idea. It might sound like, okay, that's good because the app is doing the extra work for the user, so they don't actually have to save themselves. But what is actually happening is that people were, whenever that save button was not there, people were getting unsure whether the information is saved. And once they went through the tracking, entered all this information, they really don't want to accidentally lose that information and have to log it again. So whenever the app was auto-saving and the save button was not there, people were getting quite concerned and reluctant of clicking out of the screen and, for example, going back to the homepage, because they were like, well, I'm not sure if I'm going to lose that information. I can't really see how to save it. So this is a simple thing, but it does make the experience better, so people feel comfortable that they're not going to lose their entries and they don't have to log them again. Another thing is that the app is using, in a lot of the places, the app is using controls that are easier to interact with. So for example, checkboxes, little icons, or like little buttons like that are easier to interact with than, let's say, drop downs and sliders. So that's really good because, again, it sounds like a small difference, but if that's something you'd want the user to do on a regular basis, like every day, every little helps. So, clicking one icon is easier than typing a word or selecting from a drop-down. So that's good that in most of the places the app is using this kind of controls. Now, it's not happening in all of the places. So, for example, here in the log and attack screen, we can see that I actually have to type most of that information. So I have to type the time, I have to type the duration, I have to type the trigger, and then I have to select the severity from a drop-down. And typing on a mobile is actually pretty inconvenient for most people, because for most cases the screen is quite small, so it's quite inconvenient. So for example, one way of improving this screen could be to kind of follow a similar pattern as here. So for example, for triggers, there probably are like 5-6 very common triggers that the app creators could identify, or they probably know, and could display them as default options, and then add the user the possibility to add a custom trigger. For example, have like 5 icons with the most common triggers, and then have like a little plus icon where the user could add custom one. And again, it sounds like a small difference, but every time, if the user has to come here every day, or every time they have to attack and they have an attack and track all that information in, it's really much easier to just tap on a little button if there's like 5-6 common triggers than actually typing it from a mobile app keyboard. And the same thing with this drop down if this was like 3 checkboxes or 3 buttons instead of a drop down, that would also be slightly easier for the user. So some of the possible changes that could be introduced with the custom categories that I've mentioned here, that could actually be that could be a pattern that could be carried on onto this screen as well. So we have 1, 2, 3, 4, 5 options for the mood, but maybe if there was a custom one that the person would want to record. So a best practice is always to have like a small number of default categories and then add the user the ability to add a custom one if they want to add a specific different mood to the application. And the same with symptoms. I'm sure these are the most common ones, but possibly there will be people that will actually experience additional or different symptoms that they might also want to record. So apart from those default ones, they might want to have like a little plus icon or a plus link that would just allow them to add a custom tag or a custom symptom. Another thing that's not exactly clear at the moment is what is happening with the data that user is entering. So a common concern with health apps is obviously the privacy and security of the information. So a lot of the time when people see those kind of tracking screens, they might be asking themselves, okay, who's seeing this information? Does anyone in the company can see and access my health data? Is it going to be shared with anyone? So these are the common concerns that people have in terms of health apps. So it is a best practice to make it clear to the user what's happening with the health information that they track through the app. So as far as I'm aware, in this application, it looks like it's all just saved locally on the user's phone. So it's not being shared with anyone. But to be honest, this is my assumption right now. It's not really explicitly explained to the user. And this is just something to think about if you want to build trust and build credibility in your product. So whenever there's anything related to health data, you want to be transparent and explicitly reassure the user that their health data is safe with you, because that's a very common concern. And that's something that will be on people's mind when they trying different health apps. Then one last thing that I would consider in this type of application is whether the user is likely to understand all the medical terms that are used in the application throughout this tracking screen. So it comes down to who's this app is actually designed for. So someone who has been managing asthma for a long time, most likely they will understand what all of those symptoms mean. But given the app is designed for kids, so it might be someone who, for example, was just diagnosed, and maybe it would be worth to explain to them what it actually means. Like wheezing, is that clear to everyone? Does anyone know what the symptom actually looks like, actually feels, or how to recognize it? So this kind of additional support for any and additional information for any kind of medical terminology throughout the app, that would definitely be helpful for some users. But then again, it does come down to the design team deciding like who this app is actually designed for, and are they likely to understand what all of those words mean. So let's have a look at how the app is visualizing the information that the user tracked. So I can go onto this graph icon in the bottom navigation, and here I will be able to view all the different summaries on a monthly basis, basically. So I can view the overall severity of my symptoms for this month. I have this key at the bottom so I can remember what color means what. Then I can view the overall mood, and for the asthma attacks, I can just view how many days with an asthma attack I had in this month. And then at the very bottom, I can also see a quick summary of the most frequent symptoms, and I can change if I want to see that for the last 3 days or 10 days or 30 days, or whichever number I select here in this drop down. So first of all, obviously it's very useful to provide summary of tracked data, because people, if they want to track their symptoms or their activities, they do it for a reason. So they obviously want to get something out of it, and that's typically either understanding patterns and learning more about their condition, or viewing whether they've made progress. So, for example, viewing if they, let's say, had less asthma attacks in this month comparing to the previous month. So designing this kind of screens, it always comes down to asking yourself who's actually looking at this data and what is it that they want to learn. So, for example, specifically in the example of this application, which is designed for kids, we could ask ourselves, who's actually looking at this? Is it the kid that's using the application, or maybe it's the parent and the doctor when they're trying to come up with a treatment plan? And that's very important to answer questions like that, because obviously the design directed at the kid will be very different than design directed at parent and doctor. So looking at this data at the moment, what I can learn from it is basically whether the severity of the condition was changing month by month, whether my mood was changing, and whether the overall number of asthma attacks and most frequent symptoms were changing month by month. So this is a very useful information for the doctor and the parent, so they can work together to better manage the condition. Obviously, this can help the doctor that is treating this patient to come up with the right action plan, the right treatment plan, or maybe see if the current action plan has to be changed. Now, a couple of changes that could make the design of the screens a bit more useful. So right now I have summaries of all those different categories, but what's actually really useful is to provide correlation between different data points, because that's something that can actually really help people spot patterns. So for example, if this app could display an easy view to see if there was a correlation, for example, between the severity and the mood, or severity and the triggers, that can actually tell you something. So you can, for example, look at, okay, so this specific trigger typically, makes it much more severe, but this other trigger, it does make it flare up, but not so much. So you can start to understand on a more granular level the condition and how it's affecting the patient. And again, that can really help help the patient and help their support team and their care team make changes and take action that will make it much easier and much more manageable for the patient. Equally, if they could show correlation between severity or attacks and medication intake, that can also tell a lot to the support team, so they can make appropriate changes. So this kind of correlation between different data points is always very useful when designing this kind of data visualizations. Another thing that could be useful that's not happening at the moment But for example, if I'm looking at this summary of asthma attacks and I see that there was 2 or 3 days in a row which had quite a few asthma attacks, as a user, I might want to click through to those days to see the actual detail behind it. So, so right now from this is quite static view. So even if I click on those days, it's not actually me taking me to that entry. Which, you know, it probably a lot of people will expect that if I click on this date, it will actually take me to where I can see the detail for that entry. And equally for the severity, if I look at this and I can see, okay, so in this week I can see there's 3 or 4 days which were extremely bothersome. I might want to click through into these days and actually see what was happening there. But again, actually the main thing with designing this kind of information will be to ask yourself who's actually looking at it and what it is that they want to know. Because, for example, if this is meant for the kid to look at, perhaps this kind of calendar view might not be the most engaging way to present this information. So we've seen that in some other areas of this application, they're using this kind of cute monster characters to kind of help the user set up goals and just make it more engaging for the user. So they could take that pattern and use it here as well, because, for example, if it's for young kids or for young people, it may be a more appropriate format is some kind of narrative or storytelling that could use these monsters, where the monster can pop up here on the screen and they can say something like, you know, you've had less and less asthma attacks in this month. It seems like you've been taking your medication much more regularly. Well done, keep going. You know, this kind of narrative might be more interesting and more engaging for the user if it's designed for kids to interact with. Again, it always comes down to thinking about who's actually looking at it and what it is that they want to know. So next thing we can look at is how the application is providing educational content and information to kind of help people learn more about asthma, especially if someone was recently diagnosed. It would be quite important for them to kind of learn more about the condition and how to manage it. So we can see that from the homepage. We can just go into this about asthma section, which will take us to this resources page. And here we can see that we just have those 6 high-level categories. So for example, so these are really just kind of short articles that are telling me a bit more about these topics. So if I go into the symptom category, it's just telling me more about symptoms. If I go into this triggers category, again, I can just learn some additional information. What are the triggers, common triggers, how you can deal with triggers, and similar for all the other categories. So one of the things that is working quite well here is we can see that all of the written text and all of these little articles are presented in quite digestible way. So we can see that they're using short paragraphs, they're using a lot of bullet points, there's a lot of headings that are breaking down the text. So all of these things, they kind of make it more digestible, more easy to scan visually and kind of get a grasp of what this article is about. So that's really good. One of the things that could improve the experience here for the user is, which is something that a lot of the apps are doing currently, is to find a way and design a mechanism for the app to recommend the most relevant content to the user based on the information that they tracked. So for example, we can see that in this section here, they're talking specifically about different how to deal with different triggers. So we can learn from the short paragraphs that there are some triggers that you actually can't do much about. Whereas there are some triggers that, you can take some specific actions to avoid, and then, how you should come up with your own ways to deal with those triggers. So, for example, what a lot of apps are doing, and what could work for this app as well, is to correlate it with the user's tracking information. So if I tracked that I had an asthma attack and I selected specific trigger, they could actually just display the information about that trigger here and then. So it's much more contextual, it's much more relevant, it's based on what I've actually tracked. And it saves the user having to go into resources section and explicitly search for that information. It just makes it easier in the way that, the most useful information is just presented to you at the most relevant time. So the next section in my review is health guidance. So this is all about the specific patterns and specific techniques the app is using to provide that health support and health guidance and recommend certain steps that the user could make to improve their health and progress on their health journey. So there's quite a lot of good examples and good practice here that we can take from this app. So the main area is in this goals page. So if I go into this shield or badge icon, the goals page is split into 3 sub tabs. So we have goals, inspiration, and support. So I'll go through 3 of them one by one. So we can start with goals. So I can see I currently have 0 goals in progress, 0 goals achieved. My goals, why don't you don't have any goals yet? Okay, so I can add a new goal. And here I can see I can choose from a list of goals, and I have health and fitness. So things like active, healthy diet, medication, take my preventer medicine every day, improve my inhaler technique, mood, the list kind of goes on. For the purpose of this example, let's say our goal is to take my preventer medicine every day. So from here, the app is suggesting specific techniques or specific strategies I can use to help me achieve that goal. So they're just giving me a list of possible techniques, and I can add a custom strategy if I want to as well. So let's say I've selected these 2 strategies. So leave my preventer out where it's visible, set an asthma reminder to take my preventer morning and night. So these are the strategies I kind of decided to set for myself. Then I get this little notification from my Monster assistant. So Robo has been assigned to this goal. He will check in with you each week, track your progress, and provide moral support. Okay, thanks. So from there, I said I've saved my goal. I can see I have this goal in progress right now. From there, it seems like this Robo will be checking in with me once a week until I'm kind of happy that I achieved this goal. So from there, I can mark the goal has been achieved, or I can change my goal if I want to. If I say my goal was achieved, he will just give me some congratulations and some positive messages to say that I've completed it. Okay, I've completed this goal. Do you want to start a new goal? So we can see that they're prompting me straight away to kind of build on the momentum of completing one goal to kind of start and set another goal. Okay, so the main thing with this flow is really that it provides the user with a sense of autonomy. So one of the very important principles, both from the user experience perspective and from motivation theory, is that autonomy and that sense of having control over the experience and having free choice to make your own decisions and your own choices is really important for the user to actually feel motivated to embark on this journey and make those choices. So what's happening here with this kind of flow that they designed for setting a goal and then setting specific strategies, they are really giving the user that freedom to set their own goals, to choose the goal that is actually relevant to them, and to choose the strategies that they feel like will work for their particular case or their life or their routine. And that's very important if we want to make this user actually successful in this journey and in completing and achieving those goals. You can easily compare this approach to just the app telling people what to do, like giving them kind of directions and instructions. Obviously, no one's gonna do something just because the app told them to do it. It's the same with people that don't follow their doctor's recommendations. Well, if their doctor told them to do something and they're still not doing it, they're not gonna do it just because an app told them. So it's very, very important whenever the app is providing some recommendations and prompting the user to take some actions. It's very important that there is this sense of autonomy and sense of control built into that flow. And this app is a really good example of how that can be done. Because here we can see that the user really has the freedom of choice to select the goal, to select the one that's important for them right now and the one that resonates with them most, so something they actually care about. And then select the strategies that they feel like can really work in their lifestyle. The other thing is that this app is incorporating like an actual behavior change techniques. So there's 3 post-it notes here: goal setting, action planning, and problem solving. These are from the behavior change technique taxonomy created by UCL. So that's a list of 97, I think, behavior change techniques categorized into 16 high-level categories. So these are behavior change techniques that are used by coaches and professional behavior change specialists. And so we can see how the app is actually incorporating the specific techniques that are described there. So as an example, we obviously have action planning and problem solving. So action planning is about prompting the user to come up with specific actions and really plan it where and how they're going to do it that will contribute to the healthy behavior that they want to start. So, for example, leave my preventer out where it's visible. Very tangible, very simple action that someone can take to kind of make them remember to take their medication on time. And it's the same with problem solving, really. We're kind of looking at, okay, what could be possibly causing me to forget, or what could be the reason for why I'm not taking my medication as regularly as I probably should have. And again, just prompting people to come up with specific strategies that they can do to prevent that from happening. And it's also really important that these are kind of like an actual practical techniques that people can do. It's taking their life, their routine into consideration. We can see here the ones that I didn't choose for this example. It says, make it a habit to take my preventer when I brush my teeth, or keep a preventer at all homes that I spend time in. So we can see that it's really taken into consideration the user's routine and user's lifestyle. So it's not just relying on setting reminders or the kind of badges and points and the kind of extrinsic techniques and motivation. It's really trying to prompt the user to think about their scenario, their situation, and how they can introduce those different techniques in their daily life. So the second tab is the inspiration. So what they're asking me to do here is to add my motivation and add my quests. So let's have a look at the motivation first. So I want to control my asthma so I can go out more with friends, for example. So I can obviously add my own one. I want to control my asthma so that I can, and I can choose my own reason, and then I can assign an icon to represent that motivation. So let's say I said I want to play more badminton with friends, and I picked the little star icon. So this is my motivation now for why I want to control my asthma better. Now my quests. So these seem to be more of kind of high level future goals. So what are your dreams or goals for the future? Work with children, become a doctor, and so on, so on. So similarly, I can add my own quest. I can add my own description for what it is that I'm dreaming about, and then I can add an image. So here, let's say I said I want to become a singer, and that's my quest. That's my big goal for the future. So what's happening here is obviously they're making it much more relevant to the specific user and tapping into why they actually want to control their condition, and what kind of benefits that they personally care about it will bring into their life. So if you are familiar with the motivation theory kind of popularized by Daniel Pink, you'd know those three elements: autonomy, mastery, and purpose, that are said to be required to tap into intrinsic motivation. So what's happening here, we can see that they're clearly just tapping into that purpose. So they're trying to get the user to think about what's their purpose in controlling their asthma better. So what it is that they actually care about, what it is that they want to achieve. So this is great. This is really great because they're tapping into this intrinsic motivation, which is obviously much more powerful and much more successful than just relying on points and badges or reminders. It's really trying to understand the user, trying to understand their motivation, which will make it much more possible that the user will actually succeed on this journey. So the last tab in this section is supports, and this is really for the user to list the people that can support them on their journey. So if I click on this add support, I can literally just type in the people that I know I can ask for help. It's not really doing much more than that. It's literally just listing them here. But I guess it can just encourage the user to ask for help if they need to, and to kind of just remember that whenever I need help, there are these people that I can always ask for help. So the only other thing related to the kind of health guidance and how the app is providing recommendations and kind of recommending the steps that the user might take in different situations is this emergency support section. So that's easily accessible from the homepage. So this big, the most prominent button on the homepage which says emergency support. And from here, I can access this asthma first aid. section. So that's to explain to others how to help me if I have an asthma attack. View action plan, that's something that the doctor would develop with the patient, and also I can add more emergency contacts here. So if I go into this asthma first aid, that's literally just taking someone step by step on what to do if someone is having an asthma attack. So the good thing about it is that it's really kind of digestible and small bite-sized information, like very clear instructions, step by step. And then if you expand one of these sections, again, it's really just telling you bullet points, so very easily to just glance, to scan through if you're in a stressful situation. So obviously, if you were to assist someone who's actually having an asthma attack, and let's say you're not really knowledgeable about asthma, you don't know what to do, then obviously it's very important that it's kind of very straight to the point, very easy to glance, and something that can actually help you help this person. And then it's also just giving me information on when I should actually just immediately call the emergency helpline or call for the ambulance if any of those things listed here are happening. So that's I think that's especially this asthma first aid show to others. Considering the app is designed for kids, I think that would be especially useful function. So you can imagine a situation where obviously kids are at school, or there might be on a summer like camp during a vacation period or anything like that. So somewhere that they would be under the care of other adults, not necessarily their parents. And those adults might not be trained in how to deal with asthma attack and what to do in certain situation. So having something like that they can easily show to this guardian or whoever is caring for them at the time, I can see how that can be very useful. So that's KmAsthma reviewed from the perspective of user experience design. So to summarize just really briefly, I think definitely the strongest point of this app is this section for goal setting. So I think that's an excellent example of incorporating this autonomy principle, which is where instead of just giving direction to people, you're actually prompting them to come up with their own strategies based on what they actually care about, based on what they want to achieve, which it's clear that it would be much more successful method than just telling people what to do and just telling them directions. And equally, this section with my motivation and my quest, so adding my own custom motivation for why I want to improve, how I manage my condition, which is again just tapping into this intrinsic motivation and prompting the user to think about their reasons and their purpose in trying to manage their condition better, rather than just relying on points and badges and reminders, which are all kind of more of an like external triggers and external techniques, which are also helpful, can also work, but probably much more deep and much more successful strategies are those that really tap into that intrinsic motivation of the user. So in this app review, I used my UX checklist for digital health and well-being apps. So if you want to get this checklist and score your own app and review your own app against those guidelines, I'll put a link either on the video or in the description. So this checklist contains over 70 individual checkpoints for the kinds of typical functionality that health and well-being apps tend to have. So from onboarding and homepage to tracking, visualizing health data, content, and providing health guidance. And what this checklist allows you to do is just go through each checkpoints and score yes or no, depending whether your app meets or doesn't meet this criteria. Obviously, if your app doesn't have that specific functionality, you can say not applicable. And then the checklist will automatically calculate the score for your app in each individual category, so you can kind of in one glance see what like the weakest points of your app and the strongest points of your app, and you can kind of really easily see what you need to work on to improve the user experience of your app. So all these checkpoints are based on my independent user testing of 20 different health and well-being apps. And for each checkpoints, you also have a reference to the specific guideline in the report, and together with the checklist, you'd also get the actual report, which is summarizing the findings from my independent user testing sessions, summarizing all those 70 guidelines. So in the report, it goes through like the typical functionality the tested apps had, typical user journey in health and well-being applications, high-level principles for designing user-friendly health and well-being apps, and then it gets into the actual 70 guidelines in the 5 different categories, and each guideline, let me just get to it, each guideline contains additional example of what that means and is illustrated with several examples with screenshots and quotes from user testing. So that's available to purchase from my website. Now, if you don't have time to review your own app, you don't want to go through the entire report, or you just want someone with a professional expertise to actually review your app for you, I also provide UX reviews as a service. So in the service, we would go through a very similar process as the one I did for this review video. I will review your app against my research. I will take screenshots of all the key user flows. I'll put them up in my digital whiteboard, and then we'll get on the call. I share my screen and we'll kind of go through your app screen by screen, just calling out what's currently working well and providing actionable ideas and actionable recommendations for improving the UX of your app. So thank you so much for joining me today. If you have any questions, find me on Twitter, on LinkedIn, or just email me at contact@panacea.digital. And I look forward to seeing you in the next review.